Hello friends, let us now learn about we have already learned about the barium swallow. So first we have learned about in the barium swallow indications and contraindications of barium swallow. Then we have learned about the contrasts technique used in barium swallow. Now what about the specific conditions of barium swallow? Specific conditions and how versus barium swallow. How are you going to do a barium swallow in different conditions? Okay, so first starting with, if the patient suffers with severe dysphagia to both solids and liquids, that is, both the patient is not able to or he is finding difficulty in eating both solids and liquids. In such cases, we will give a little of diluted barium is given. Diluted barium is given of around 5 ml is given. And you will have to see the rest same. Films are taken and then in lateral, frontal and right anterior oblique and left anterior oblique views. Then second, if the patient has pharyngeal web, if the patient has pharyngeal web, because there is a web, the contrast is we should use 50/50 dilution of standard high density barium is preferred. 50/50 dilution of standard high density barium is preferred for pharyngeal web. Then obviously we will have to take the films in frontal, erect, for lateral views. You can take for the pictures. So actually frontal and among all the views, frontal and lateral views are best for a pharyngeal web. Then second, if the third disorder is if there is any foreign body impaction. If there is any foreign body impaction, here you will have to ask the patient to take or to swallow a marshmallow. We take a marshmallow and it is coated with barium. And this marshmallow is asked to swallow. The patient will swallow the marshmallow. Okay. Now, if there is any obstruction, if this is the esophagus, if this is the esophagus and if there is obstruction here, then obviously this coated marshmallow will not pass beyond the obstruction. So here the passage is stopped by obstruction if there is any obstruction. Okay, you can either use marshmallow coated with barium or sometimes we can also use cotton soaked with barium can also be used. But what is best? This marshmallow coated with barium is best because the marshmallow is a food, it is an edible agent, and because this marshmallow is an edible agent, this will dissolve. So as a result, this marshmallow coated with barium is better than this cotton soaked with barium. Then, if the patient has any carcinoma, if the patient has any type of carcinoma, then we can use either a high viscosity, normal density liquid can be used. High viscosity and normal density liquid is used. Second, then if the patient suffers from any motility disorders, in order to study the motility disorders, we will ask the patient to take a minimum of 5 mouthfuls of contrast. Instead of 1 or 2 mouthfuls of contrast, we will ask the patient to take 5 mouthfuls of contrasts are taken. And out of these 5, at least if more than 2 mouthfuls are abnormal, then we can say it is a positive diagnosis. Okay, in motility disorders, we will give a prone swallow is one thing which is important. It is this prone swallow is important for assessment of esophageal contraction in absence of gravity. Without any gravity, whether there is any esophageal contraction or not can be found out by this prone swallowing. Prone swallowing is the patient will sleep in prone position and now he will swallow. Okay, so on prone swallowing, you can find the esophageal contraction in the absence of gravity. Then, then what about the technique in achalasia? In achalasia cardia, number one, esophagus should be washed clearly. Esophagus is actually cleansed thoroughly. Why? Because in the achalasia cardia, we have a secondary achalasia. This secondary achalasia occurs due to a carcinoma of esophagus. This secondary achalasia, which is occurring due to carcinoma of esophagus, might miss if the esophagus is not cleansed properly. And then in achalasia, we use 80% weight by volume of barium is used and the patient is in erect position. Now, in order to differentiate barium from other motility disorders is by two ways. Differentiation of achalasia from other conditions. The achalasia can be differentiated from other conditions by two ways. One, we can administer meconill. Okay, this meconill will cause increased peristalsis or hyperperistalsis, and because of this hyperperistalsis there can be pain or streaks of contrast entering the stomach. Okay, so this hyperperistalsis will differentiate between achalasia from other disorders. Second, we can also give amyl nitrate is given orally. This amyl nitrate will cause mild relaxation of the stomach, of narrowed portion of the stomach, and this mild relaxation, okay, because of this narrowed portion of esophagus, okay, this mild relaxation will cause small streaks entering the stomach. These two ways, so this will result in small streaks entering stomach. So by these two ways we can differentiate the achalasia from other disorders. Okay. Then the next disorder is hiatus hernia. What about the barium meal in hiatus hernia? So in hiatus hernia, okay, if we have to demonstrate hiatus hernia, we need high abdominal pressure. We need high abdominal pressure to demonstrate hiatus hernia. To demonstrate hiatus hernia, we need high abdominal pressure. Okay. Now, we have to ask the patient to lie down. And first ask the patient to lie down and then straighten the legs and raise them up. That means the patient should be like this. He should raise the legs up, and then we should ask the patient to manually compress the abdomen. Okay, and then you should ask the patient to stand up straight up, and after standing straight up you should ask the patient to bend downwards like this. Okay, So this maneuver will increase the abdominal pressure and thus it will help to diagnose hiatus hernia. So if you wanted to diagnose hiatus hernia, first you should ask the patient to lie down, then straighten the legs and raise them up like this, and then compress the abdomen manually, and then stand straight up and then bend down. This maneuver will increase the abdominal pressure and will help us to demonstrate the hiatus hernia. Then next we have gastroesophageal reflex. Then, the next disease is gastroesophageal reflux disease. For gastroesophageal reflux disease, we can do a test called as siphon test. Okay, in this siphon test, first you will fill the stomach with 50% of barium. So if this is the stomach, you will fill the stomach with 50% of barium. So you are filling it with 50% barium. And this 50% barium will account for around 150 to 200 ml. Okay, this is step number 1. Then step number 2 is you will ask the patient to take 1 to 2 mouthfuls of water. When you take 1 to 2 mouthfuls of water, this will remove the barium in esophagus. Okay, because of taking water, this water will remove this barium in the esophagus here. Now the barium in the esophagus is not there. Now the barium is only present in the stomach. Right? Now the barium is only present in the stomach. Now you will have to ask the patient to lie supine. So this is supine position. Okay, and then you will ask the patient with left side. He should be in supine with left side to be raised around 15 degrees up. That means he is in supine position, but the left side, if this is right, in this is left. Now this left side is raised like this. It is raised 15 degrees up. This left side is raised 15 degrees up. Okay. Then followed by this, you will ask the patient to keep a mouthful of water. Now he will have to keep one mouthful of water in his mouth. In patient's mouth, you are asking to keep one mouthful of water, and then he will have to swallow this water. When he swallows the water, now you will take the X-ray. Okay. While he is swallowing the water, while swallowing this water, you will take the X-ray. Now, this what happens if you do this? If you ask the patient, now actually the whole stomach is filled with barium, number 1. Then, and also esophagus. When you ask the patient to fill the stomach, esophagus and the stomach is filled with barium. Now you will ask the patient to take 1 to 2 mouthfuls of water. When he takes 1 to 2 mouthfuls of water, this will remove the barium in the esophagus. Then you will keep the patient in supine with left side raised to 15 degrees up. Now ask the patient to keep mouthful of water, and you will ask the patient to swallow. Now at this stage, when the patient swallows with water, the barium which is present in the stomach, it will enter, it should stay in the stomach. But because of this reflex, here the patient has reflex. So when he takes the X-ray, because the patient has reflux, you will see that the barium will enter the gastroesophageal junction. So now you will see this reflux of barium into the gastroesophageal junction like this. Okay, by this you can diagnose the gastroesophageal reflux. Or second, you can also keep the patient in, or you can, the second technique is, or you can ask the patient to be in supine position, and you can ask the patient to roll from side to side on the table. You will ask the patient to roll from side to side on the table. When he rolls side to side on the table, then definitely you will see the reflex. Okay. Next we have esophageal varices. How are we going to diagnose esophageal varices in the barium swallow? In esophageal varices, you have to ask the patient to keep in supine position, and right side should be up. Supine position, right side up position is the position of the patient for giving the, for taking the x-ray. Then you should use the contrast used for esophageal varices is high density barium is used. Okay, by this you can demonstrate varices. Varices are also demonstrated by one more thing that is called as mucosal relief study. In mucosal relief study, we use Buscopan and also Valsalva. With the help of this Buscopan and Valsalva maneuver, we can demonstrate varices. These both will demonstrate varices. Okay, next. So these are the different diseases which can be diagnosed by barium swallow. Now, what about the complications of barium swallow? One important thing is this is barium. So if there is any perforation in the esophagus, okay, if there is any perforation, okay, now this barium which is taken in, it might enter the mediastinum or pleural cavities through this perforation. And once it enters the mediastinum or pleural cavities, here the patient will develop symptoms of uh, severe symptoms, and it might result in granuloma formation later. This is one complication. Sometimes barium can also be aspirated into the lungs by the patient. So these two are the complications of barium swallow. Thank you.